early as that age. And we've seen, I have a couple of teenagers at home right now. And that can include like menstrual cramps, moodiness, premenstrual symptoms. It's very important that these hormones get balanced out initially. And because we are living in such a toxic environment, in such a plastic environment, right? Many women are experiencing estrogen dominance without even knowing it. And balancing out the ratio between estrogen and progesterone is extremely important to having harmony throughout the month. There is a doctor by the name of Dr. Katharina Dalton who did extensive studies on premenstrual symptoms in England. And there's a book that I highly suggest for younger people actually to read. It's called Once a Month. And there's a chapter in that book for men, and it says advice for men. So, what she talks about is that a lot of, she did studies, and in jail, a lot of crimes that were committed, or a lot of tests that were flunked, that kids couldn't concentrate, it was actually right before their periods. It was in the premenstrual, they had the PMDD or PMS. Now, the conventional way of treating PMS is by starting a patient on an SSRI or an antidepressant, which works, but it's not really addressing the root cause of the problem. The root cause is really when we have, and I wish I had my slides, when we have these hormones initially, after you get your period, you have a lot of estrogen. Then the second phase, the progesterone is supposed to be higher to stabilize the lining of the uterus in case of a pregnancy. But what happens 1 to 2 weeks prior to menses, if your estrogen ratio stays elevated compared to the progesterone, meaning that the progesterone is now lower than the estrogen, you will have symptoms of estrogen dominance, which is estrogen, which is breast tenderness, water retention, sugar cravings, irritability, aggression, and that's what those PMS symptoms are. Now, a little bit of natural progesterone cream or progesterone capsule can turn these patients around completely. And within 2 to 3 months, the PMS will completely go away. I had a patient who came from UCLA, and she was given all sorts of antidepressants. She had severe PMDD, and no matter how many antidepressants they gave her, it wasn't really getting rid of her PMS symptoms. So by putting her a little bit of natural progesterone 1 to 2 weeks prior to menses, the PMS symptoms completely resolved for good, because it was that estrogen dominance. So that was a little introduction for the younger people in the group. But now let's go forward. Generally we go into menopause around 50, 52, but I think that our premenstrual or premenopausal symptoms can start as early as age 40, maybe even in our 30s. So that's why it's so important to balance out the ratio between estrogen and progesterone. So when I do my panel, I actually have women do if they're menstruating still, I have them do their blood work on day 19 to 23 of the cycle. Then I will divide progesterone over estrogen and look at the ratio, and I want that ratio to be between 200 to 500. Guess what most women's ratio is? Most women's ratio is around 4, 5. So they are so estrogen dominant, and they're wondering why they feel so awful, right? Breast tenderness, water retention, belly fat, they can't lose weight, irritability, aggression, sugar cravings, all of those are symptoms of estrogen dominance. So I go over all the history, right, in the consultation room. Then I take them to the exam room, and almost always, when I examine them, I can see that their tongue looks like a strawberry. So they have these red dots on top of their tongue, and they have these red dots on their chest, which are called cherry angiomas, because too much estrogen can attack the blood vessels and cause these little red dots. And I don't know if you guys have noticed it. I want you to check yourself when you go home and look in the mirror. Have you been having more cherry angiomas as time is passing? Right? And that by itself can indicate that you're dealing with estrogen dominance. There is an herbal remedy that Dr. Chen, I believe, created. It's called Myomen, which is a combination of 3 different herbs, and that would actually balance out that estrogen and progesterone. I also use DIM in my practice to balance out estrogen dominance. And then again, a little bit of natural progesterone can go a long way. Now, for those women in the audience who are having insomnia and they're just, no matter what they do, no matter what they take, they're on magnesium, they may be taking Ambien, I mean, you name it, trazodone, right? And they're not able to sleep. They feel like they're coming out of their skin. Literally, they feel like they're coming out of their skin. What they need is progesterone. Now, when we are dealing with a patient who has insomnia, we would want to give that progesterone in a capsule form. Thankfully, right now, as the OBGYNs in the room know, we have natural progesterone that is actually covered by insurance. It's called Prometrium. One of the things I want you, that I will go into details is I want to distinguish between the difference between progestin versus progesterone. What I'm talking about right now is progesterone, which is natural, exactly identical to what our body produces. I do not want anybody to be on progestin. That's not what I'm talking about. I'm talking about prometrium or progesterone, about 100 to 200 milligrams